And where else would you rather be if not glued to your screens with your favorite hosts? Yes, I might say that. Your favorite hosts as Report Desk Africa takes you on a journey through the African stories that are moving and shaking this wonderful continent. It's good to have you join us on a fresh episode of Report Desk Africa, or as we call it here, RDA for short. My name is Blessing. Oh, wow. My name is Bernard Akede. Actually, I was going to say my name is Blessings Mosugu. My name is Bernard Akede, but yeah, Blessings is right here. I just let her out even before she came.
No, you should have just let it. It would have been smooth if I said my name is Bernard Akede. My name is Blessings Mosugu, and yes, you have a right to be informed. And we on Report Desk Africa have taken up the responsibility to update you on the latest happenings in Africa. As always, you're welcome. Now, all you need to do is stay tuned, sit back, relax, whatever you have in hand, your coffee, your drink, whatever. Report Desk Africa has got you covered with the top stories, and we have two major stories. Another pandemic, first of all, is looming, and World Health Organization has declared the highest alert over the monkeypox outbreak. Now, this story will form part of our conversation on today's episode. We have another story, but I'm not going to let the cat out of the bag just yet. Don't go anywhere. We'll be right back.
Thank you for joining us. If you're just joining us, you've only missed the introductions of the show. This is Report Desk Africa, where we try to bring you some of the most happening, if you like to use that word, stories across the continent from the beginning of the week up until today. And now, the World Health Organization has activated its highest alert level for the growing monkeypox outbreak, declaring the virus a public health emergency of international concern. Now, with over 1,400 cases from Africa, monkeypox is not a new virus. It has, however, drawn more attention as it spreads to the non-endemic areas, and a new mode of transmission has been detected. Now, while further public health investigations are ongoing, Africa is on high alert as there is no cure for this virus just yet. Now, we'll take a quick break while we take a look at this report concerning monkeypox virus, which has been put together by our very own correspondent, Niyi Omoniyi. And after this report, we'll come back and join our guest to discuss the virus.
After monkeypox cases exploded last month in countries such as Portugal, Spain, and the United Kingdom, where outbreaks don't usually occur, a rapid global response followed, including distributions of vaccines in some countries. But monkeypox outbreaks have been occurring in parts of Central and West Africa for years. The situation is evolving, and the World Health Organization expects there will be more cases of monkeypox identified as surveillance expands in non-endemic countries.
Since the beginning of 2022, cases have been reported in Africa from Cameroon, the Central African Republic, the Republic of the Congo, the Democratic Republic of the Congo, Liberia, Nigeria, and Sierra Leone. WHO and partners are joining forces to urgently understand the magnitude and cause of the global outbreak.
The new modes of transmission are also a thing of concern, as monkeypox is primarily spread through close person-to-person contact and direct contact with sores and bodily fluids from infected people.
Although I'm declaring a public health emergency of international concern, for the moment, this is an outbreak that's concentrated among men who have sex with men, especially those with multiple sexual partners.
Noting that monkeypox has been largely ignored by Western nations until now, and judging by the experience of vaccine inequality during the COVID-19 pandemic, African scientists call for increased surveillance and investment in testing.
If we have funds for future epidemic preparedness, we can then use it to respond to epidemics as they come. First and foremost, we need to train more epidemiologists. We need to train even the locals on the basic recognition of a disease that can be a problem.
So it's a cause of concern because now that means the disease is spreading in a different way. That scientists need to find out how it's spreading, how fast it is spreading, and will it maybe develop to be severe or it will remain mild as it is.
As Africa CDC, we have provided guidance to our member states on increasing surveillance for monkeypox, establishing laboratory diagnostic capacity so that it can be easily lab diagnosed.
Parts of Africa may well have built up some immunity to monkeypox, but equal access to effective vaccines is critical to protect the continent's particularly vulnerable populations, including health workers and the context of cases.
While there is no current treatment for monkeypox, the focus, however, is on transmission prevention before it becomes another pandemic like COVID-19. Niyi Omoniyi, reporting for News Central.
That was a comprehensive report package on monkeypox virus by Niyi Omoniyi, our correspondent. Now, we have been told that the monkeypox virus is very similar to smallpox, but also we've been told that it has much less severe consequences and that it clears up within 14 to 21 days with milder symptoms. However, the World Health Organization has declared monkeypox a public health emergency of international concern, and that's because it's spreading so fast, so wide. Now, it's looking like the causative factors, which are the rodents, may not be the only reason why this is spreading that much. Now, we're going to be taking a look at this in depth, and joining us now to examine this is virologist Dr. Kolawole Oladipo. Thank you so much. You're welcome on the program.
Oh, thank you for having me on this program.
You're welcome. Now, Dr. Kolawole, considering what the whole world has been going through since the COVID-19 pandemic, people are now asking the same question, and that question is monkeypox something we need to be worried about? I mean, like I said earlier, they said it's nothing to worry about. They said it has milder symptoms, but it's spreading so fast. So what are the facts of monkeypox that we need to know?
Well, I think let me start from these. Viruses are being classified into groups based on some features, some characteristics. Now we have what we call DNA and RNA viruses. So DNA viruses are viruses that are stable genetically to a large extent, and RNA viruses are not stable because of mutation. So the rate of mutation is higher in RNA viruses than DNA viruses. And that's what explains the reason why monkeypox is a DNA virus and its spreading can be curtailed owing to some factors which if we all put in place. And that is why you don't see a lot of variants like SARS-CoV-2, which is an RNA virus. You can't see a variant of monkeypox coming up. So one thing that we are happy about is that it's a DNA virus, and there is a way DNA viruses are more stable. So that's why we have nothing to fear when we compare with SARS-CoV-2, which causes COVID-19.
Thank you, Doctor. Now, the first time that that many monkeypox cases and clusters have been reported currently in non-endemic countries, this is the first time. So, what do you think could be the cause of this particular virus spreading beyond where it was before, and the cases increasing in numbers that are larger than what we've seen in the past?
Yeah, I think that is the reason, one of the major reasons why WHO declared it as a public health emergency of international concern. And when such is declared, it has two out of its meaning or complication is that it's going to make other countries that have not recorded to be on alert, to put a proper surveillance in place so that they'll be watching out for that infection in their country. Then the country that has recorded should be able to put some measures in place in order to halt the transmission chain so that we not have more of these cases in other places that have not been recorded. Now, what is there is that we are not recording it in this other part of this world, of course, and now we have more international travels. People travel a lot, and this is one of the major contributing factors to what we call re-emerging and emerging infectious diseases. And don't forget that we have effect of climate change. So climate change also has a drastic effect on how this pathogen surfaces. So I myself, from my own point of view, I can attribute the scene of this to either travel where someone has traveled to a place where it's endemic, got the virus, then travel down to his own country, and through activities and methods by which the virus can be contracted, then it increases the community spreading in that community. Then two, the viruses are being distributed, are being spreading because of climate change. So ordinarily, an environment where you ought not to see them, you start seeing them. So those are the two factors I can talk about now.
Okay. Now, Dr. Kolawole, before now, we know that the monkeypox virus is transmitted through close physical contact, which includes skin-to-skin contact, kissing, as well as respiratory droplets at close range. But the World Health Organization has recently also announced that monkeypox is being driven overwhelmingly by sex between men, like we saw in the just aired reports. Now, what would you make of that?
Now, it's still the same mood from my own point of view, in the sense that there is a contact. It means body-to-body contact. So if there is no contact, the virus cannot spread. So what really happened is that someone that has been infected had a contact with non-infected person. Then how faithful are we to each other? So the person that got infected went to another place, got infected. Not only that alone, don't forget that the fluid of such an individual person, if non-infected has tears or scar on his body, has contact with that fluid, it's possible for he or she to have the virus. So that's just another way that has been established. The major thing is still contact to contact. So somebody that is infected is having contact with non-infected person, and the virus is able to pick up. So I dwell much on avoiding contact with people that are suspected to be the virus, to be the carrier of the virus, or we all wash our hands and take care of our personal hygiene as much as we can.
Now, Dr. Kolawole, I know that monkeypox virus is not the same thing as the COVID virus. They're not even remotely similar. But one thing about the COVID virus that really hit the world is the fact that it was something new that specialists didn't exactly have large knowledge about. But for monkeypox, it has been around for quite a while, particularly in Africa. And you've explained that crossing to other climes is a function of people traveling and moving around. But we're still trying to find out if monkeypox virus is particular to a certain kind of demographic, say maybe young children, people of middle age, adults. Is it particular to men, to women, or is it something that is general and can cut across all demographics and hit anyone in any place at any time?
Yeah, it cuts across all demographics. I will just reflect back that that when we all are young, we took the vaccine of smallpox. And this monkeypox and smallpox, they are in the same family, Poxviridae. So there is a level of protection that those who have been vaccinated against smallpox have against monkeypox. So that has played a major role. And you discover that monkeypox is part of our immunization routine for immunization for children. So we get it every day once we have a child. So we have a level of protection. That is why we have not been reporting the case in Africa, in Nigeria, like we have been reporting in other cases. Then secondly, you can't compare our detection rates, the detection robust system that we have in Nigeria or Africa compared to the Europe. So they have a better molecular biology system that enable them to detect the disease faster than what we have. So that's why we have not been seeing the cases like the way those ones have been recording. And don't be surprised that some would have had it and be using a traditional way of solving the problem without even going to the hospital. But there is a good system that captures data, and that is why we can have many, many reports compared to what we have in Africa.
Okay, also, Dr. Oladipo, now talking about the treatment methods, I would also like to know, is there difference, is there variance in immune system? Is one party more immune than the other, or everyone is as vulnerable?
Yeah, we are immune than each other. Their level of immunity differs. And there are some factors that comes into play for when we say our immunity. One of the factors is age. Studies have shown that at older age, We are prone to diseases because our cells of the body are weakened, and that is one. And two, sex-wise, in terms of male and female, we are more strong immunologically than each other, and those are the factors. Then another factor is someone that is immunocompromised. What I mean by immunocompromised is that someone that has an underlying health diseases like diabetes, HIV, cancer, and some people are on chemotherapy. So we kind of expect that such an individual and someone that is apparently healthy or immunocompetent will have the same level of immunity. So even if all of us in the same population is exposed to the disease, to the pathogen, the rate at which we're going to come down will differ. And that is dependent on our host. What is making up of us in terms of our immune system, in terms of some other factors that I will not be mentioned on the TV now. So invariably, our immune status is quite different from each other. And that is why it's going to determine how we respond to the infection. And if you look at the pathogenesis, the duration we said from 2 days to 14 days. So it means that the way each individual will respond by the time the pathogen gets into the body is quite different. And that is a factor that is being determined by how strong our immune system is. So it differs. So the only thing we can do to enhance our immune system is to take adequate rest, take enough water, take balanced diet, and stay away from germs and live a good life full of proper hygiene.
Thank you so much, Dr. Oladipo. Before we let you go, you already have talked about boosting immune system, and I see that this is actually applicable to almost every viral infection because the same thing was applicable to the COVID virus as well. And we know how many of us over here, how and what we did to boost immune systems when the COVID virus was at its peak. But finally, Doctor, I'd like to ask, concerning treatment, concerning cure, how good or how well are we doing here in this part of the world concerning treatment of the monkeypox virus, concerning seeking a cure, and particularly concerning testing, to gain more knowledge concerning as regards the monkeypox virus?
Now, I will talk in 2 ways. I have 2 points to raise. One, on testing. If not for COVID-19 that crippled him, our testing capacity was very, very poor. So what can be used to detect monkeypox is molecular biology techniques. And for now, not all hospitals, not all clinics have that capacity. So the testing capacity is not up to what is expected for us to have in this country. So, and even in some part of Africa. So our governments need to put in more effort in ensuring that we have a lot of testing centers that can do the molecular study. Though it's very expensive and it calls for expertise individuals to handle the test. But now that COVID has came in and we're able to manage COVID to an extent, I think we have to do more. We need not to relax so that we can be able to detect this virus on time, because early detection is the key. So we can be able to know the transmission chain and know how to halt the community transmission of the virus. Then in terms of treatment, for now, there is no specific treatment for monkeypox. Only what we have is the vaccine for smallpox can be used, and the treatment for smallpox also can be used for monkeypox. The only report I have is currently there is a vaccine that FDA just approved, but that vaccine is meant for 18 years above, and it's not meant for children. And that vaccine too is a live attenuated vaccine that cannot be used on immunocompromised individual, although work and study is still ongoing with that vaccine to know what it can be do, what else can be done. And I'm very sure now that scientists like others like he now have started working on how to get a vaccine for this virus, because it's an reimagined disease, infectious disease, that we need to halt its transmission now.
All right. Thank you so much, Dr. Oladipo. It was really an enlightening one. Thank you.
Thank you for having me on the show.
Deep one there concerning monkeypox. Now, Dr. Kolawole Oladipo has actually, shed more light on what the monkeypox virus is, how to go around it, and the reasons why the World Health Organization has declared it an international cause for international concern. Basically, like others were saying, and like you clearly stated, it's something that has been in existence in Africa already for quite a while, so it's not new here. But I like one thing he stated. There are people who already have been using some kind of tradomedical means to treat monkeypox virus, but because we don't have proper record taking or record keeping, we don't exactly know the degree, the degree of accuracy and how well they've treated it.
I mean, it's a I don't know. It's like a mixture of being super scared and then just be super cautious, because there's really nothing to it. Because from the research and everything, when something new comes, everybody wants to read, wants to read about it, know what to do, know what not to do. But what so many people are saying is it's not that serious. It's not as serious. And I won't say it's not that serious, but it's not as serious as smallpox, and then as it's made to seem. But then the fact that it's spreading so wide, so fast, and it's just it is a cause for concern. So we just have to be very careful, and cautious.
We have to stay safe and play safe concerning monkeypox virus. Now we have another story coming up right after the break. This is one that concerns education in Nigeria, Africa's most populous nation. Do stay with us. It's still Report Desk Africa.